Are you or someone you love over the age of 65 and taking daily medications? Then please watch this entire video carefully. It could save a life. 1 in 6 adults age 65 or older will have at least one side effect from their medicines. Older people are twice as likely to have side effects from medicines, and these effects may also be more severe in older adults. Today, I'm going to reveal 7 common medications that could be seriously harming seniors over 65, and most people don't even realize it. These medications are on what doctors call the Beers Criteria List. The American Geriatrics Society Beers Criteria is a list of potentially harmful medications to limit or avoid prescribing to people above age 65. There are close to 100 medications or medication classes on this list. So, let's get started with number 1. Number 1 on our list is a medication you probably have in your medicine cabinet right now: Benadryl, also known as diphenhydramine. Millions of seniors use Benadryl for allergies, itching, or even as a sleep aid. But here's what most people don't know. Benadryl is one of the medications that adults ages 65 and older may be advised to avoid due to possible risks. Antihistamines like Benadryl are used to relieve allergy or cold symptoms and may also be used as a sleep aid. However, many antihistamines have strong anticholinergic effects. So, what does anticholinergic mean? Anticholinergic medicines block the action of acetylcholine, a chemical messenger that helps cells talk to each other. It helps with memory, learning, and concentration. Acetylcholine also helps control functions of the heart, blood vessels, airways, and urinary and digestive organs. When this chemical is blocked, it can cause confusion, dry mouth, blurry vision, constipation, and difficulty urinating, especially in older adults. So if you're over 65 and using Benadryl regularly, please talk to your doctor about safer alternatives like cetirizine or loratadine. Now, let's move to number 2. Number 2, and this one will shock many of you, is ibuprofen, sold as Advil, or Motrin and naproxen, sold as Aleve. These are some of the most commonly used pain relievers in America. But for seniors over 65, they can be extremely dangerous. Nonsteroidal anti-inflammatory drugs, or NSAIDs, are taken to relieve pain and inflammation. But long-term use of NSAIDs can cause peptic ulcer disease or bleeding from the stomach or intestine. NSAIDs also can cause confusion or dizziness in older adults. They're often not a good combination with blood thinners, diabetes drugs, diuretics, or blood pressure drugs. NSAIDs are also rough on major organs when your body gets older. If you need pain relief, ask your doctor about acetaminophen at a safe dose or non-drug options like physical therapy. Number 3 is next, and it's a big one. Number 3 on our list is a class of drugs called benzodiazepines. These include some very well-known names: Xanax, Valium, Ativan, and Librium. Millions of seniors take these for anxiety and sleep problems. But here's the truth. Benzodiazepines are often prescribed for anxiety and related conditions, but they can increase the risk for cognitive impairment, falls, and motor vehicle accidents, leading to fractures and other serious injuries. Despite these risks, 6% of men and more than 10% of women 65 to 80 years old still use benzodiazepines. Some of these medications stick around in your system a lot longer than others. Their side effects, like confusion, can last past the day you take them and raise your chances of falling. If you're taking Xanax or Valium, never stop cold turkey. Talk to your doctor about slowly tapering off and switching to safer alternatives. Now on to number 4. Number 4 is another very common one: sleeping pills, specifically a class called Z-drugs. These include Ambien, which is Zolpidem, Lunesta, which is Asopiclone, and Sonata, which is Zalplon. These sleeping pills, along with benzodiazepines, are associated with increased risk of cognitive impairment, delirium, falls, fractures, and motor vehicle crashes in older adults and should be avoided for the treatment of insomnia. So, what's the alternative? Treatable causes of insomnia should be sought and managed before using any sleeping pills. Non-drug measures such as cognitive behavioral therapy and sleep hygiene, for example, avoiding caffeinated beverages, limiting daytime napping, and modifying bedtime routines, should be tried first. If medication is needed, safer options include low-dose doxepin, Rameltian, or Civorexant. Ask your doctor about these safer options. Number 5 is next. Number 5 on our list is muscle relaxants. These include cyclobenzaprine, sold as Flexeril, methocarbamol, sold as Robaxin, and carisoprodol, sold as Soma. These medicines have strong anticholinergic effects and often cause side effects in older adults, including confusion, low blood pressure, falls, constipation, dry mouth, and blurry vision. For muscle pain, safer options include gentle stretching, heating pads, topical creams, or physical therapy. Always check with your doctor first. Number 6 coming up, and this is especially important for the millions of seniors managing diabetes. 2 diabetes medications, glyburide, sold as Diabeta, and chloropropamide, sold as Diabinase, are on the Beers list as dangerous for seniors over 65. These older diabetes drugs can cause dangerously low blood sugar levels in seniors, which can lead to dizziness, falls, confusion, and even loss of consciousness. Safer diabetes medications exist today. If you're on either of these, please ask your doctor about newer alternatives like metformin or other modern diabetes drugs. And finally, number 7. The 7th and final medication on today's list is a class of antidepressants called tricyclics, specifically amitriptyline, sold as Elavil, and imipramine, sold as Tofranil. These antidepressants have strong anticholinergic effects, and they also increase the risk of falls, constipation, dry mouth, drowsiness, and changes in heart rhythm in older adults. Newer, safer antidepressants are available today. If you or a loved one is over 65 and taking these older antidepressants, a simple conversation with your doctor could make a life-changing difference. So let me quickly recap the 7 dangerous medications seniors over 65 should avoid. Number 1, Benadryl. Number 2, NSAIDs like ibuprofen and naproxen. Number 3, benzodiazepines like Xanax and Valium. Number 4, sleeping pills like Ambien and Lunesta. Number 5, muscle relaxants like Flexeril and Soma. Number 6, older diabetes drugs like glyburide. And number 7, tricyclic antidepressants like amitriptyline. But remember, never stop taking any medication without speaking to your healthcare team first. Always keep a list of all medications and dose levels that you take, including prescriptions, over-the-counter medications, and supplements. Bring the list with you whenever you see a healthcare professional so they can check for side effects and interactions. If you found this video helpful, please subscribe to this channel, hit the notification bell, and share this video with someone you love who is over 65. Together, we can help keep our seniors safe. Until next time, take care of yourself and your loved ones.